Hi, I'm Joe Lai, and I'm with Kirkpatrick and Lai Orthodontics. Today we're going to discuss some common bite problems that we see in children. A problem that I commonly see are cross bites. Cross bites when the top teeth go inside the bottom teeth. For example, when it happens in the front, the top teeth go behind the bottom teeth, and that's called an underbite. With an underbite, the lower jaw has grown too far forward relative to the top. In the back, a posterior crossbite can occur. What happens there is the jaw will tend to shift to the left or the right to compensate for the narrowness in the top. And that can be bad because you can develop joint problems, but really importantly is that the jaw will grow one way or the other asymmetrically. Another problem that we see are open bites. An open bite is when the back teeth touch, but the front teeth are not touching. And that can be bad because when we go to eat, it'd be very difficult to bite or cut into your food. Also, breathing issues can be associated with an open bite as well. Another problem is if the front teeth aren't touching or overlapping correctly, a tongue thrust can develop. And we want to make sure that we get that corrected early. And that's where an orthodontist can help you evaluate and determine what type of treatment will work best. Another bite problem that we see are deep bites. And a deep bite is when the front teeth excessively overlap the bottom teeth. And with a deep bite, a common problem that you can have is the bottom teeth actually hit into the gums of the top or the palate, and it can cause a painful sore in some children. Sometimes in deep bites, you have a really strong muscle pull, and so that can lead to excessive grinding of the teeth, and we don't want that because then the permanent teeth get permanently worn down. Another problem we see is crowding. Crowding alone is not always indicative of orthodontic treatment, but excessive crowding can cause problems. For example, overly crowded teeth can cause recession, especially with the bottom teeth. And what recession means is just that the gum tissue gets pushed down really low, and when that happens, it doesn't really grow back. In some cases, if the teeth are really crowded and don't have room, they just won't erupt at all and they get stuck or impacted. Sometimes the teeth are overly crowded, but they all come in and they may be overly rotated. That can be bad because if they're rotated and they go to bite down, it can cause excessive wear of the front teeth.